my name is Ellen Gnaedinger, and I'm the nurse practitioner at the South Royalton Health Center. And I'm going to talk today about preventing Lyme disease. I'm going to talk about three different things. The first thing is how to prevent a tick bite. The second thing is, what do you do if your child has had a tick on him or her for more than 36 hours? And lastly, I'm going to talk about what are the symptoms of Lyme disease and what do we do if your child has Lyme disease? So first of all, preventing Lyme disease. On the Department of Health website, you can find a lot of information about ticks and deer ticks in particular. Deer ticks have black legs. This is an easy way to distinguish them from other ticks. And on the Department of Health website, they have a small poster. It's called Be Tick Smart, and it talks about protecting children from getting the tick bites, how to remove the tick, and what to watch for should they develop the symptoms of Lyme disease. So first of all, how do we prevent a tick bite? There's different ways to prevent a tick bite. If you're going to be out walking in the woods or through high grass, it's always smart to wear pants, to wear shirts that have long sleeves. You can tuck your pants in into your boots or into your socks, and that's actually what I was doing today when I was out walking in the woods. I had my pants tucked into my mud boots. The other thing is you can get a spray, an insect spray like Off or Cutter, something like that. Make sure it has 30% DEET or more to prevent the ticks from biting your child. And the most important thing, of course, is to do a tick check every 24 hours. So when your child is having a bath or having a shower or they're getting ready for bed at night, just make it a daily routine to check for the ticks. Check the hair, check around the ears, inside the ears, check between the legs. Sometimes you even have to check in between the toes. Make sure that there are no ticks. Remember, the nymphs can be very, very small. This is a picture of an adult deer tick, but right now we have lots of nymphs, and this is a part of a dime, and you can see how tiny the nymph is in comparison to the size of the dime. So sometimes the deer tick nymphs are very small and a little bit difficult to see. If you've been out in an area where there are a lot of deer ticks, the smartest thing to do is to have your child have a shower or a bath, wash real well with soap and water and a washcloth, and put their clothes right into the wash machine. That's a really good idea. So what happens then if you have a tick on your child and you need to remove it? So you want to just get a tweezers, and wherever the tick is located, get the tweezers down right next to the skin, and you want to pull straight up to remove that tick from the skin. And if a little bit of the tick is left behind, don't worry about that. It cannot transmit, the little bit left in the skin cannot transmit the Lyme disease. And to get rid of that, you're just going to do some warm compresses, and in a day or two, the little bit of the tick that's left behind will come right out of the skin. Tape that tick that you've removed right to a light colored piece of paper. We want to make sure it's a deer tick. I'll show you a picture. The deer tick looks like this. It's kind of a reddish brown with a black patch, and they have the black legs. That's an easy way to tell them from the dog tick or the Lone Star tick, which has tan legs. So if this tick has been on for more than 36 hours, there is the chance then that the Lyme disease may have been transmitted to your child. So at this point, you want to give a call to the health center. Let us know what's happened. It's very helpful to get a picture of the tick so we can help identify and make sure that it is a deer tick. And then what we'll do is we'll call in a one-time antibiotic order. It'll be for an antibiotic called doxycycline. That antibiotic is now approved for all ages for children, and it's more than 80% effective in preventing Lyme disease. And we would have your child take that as soon as possible after removing the deer tick. There's a window of 72 hours, but it's most effective if you take it very close to when you remove the tick from your child. So that's what to do if you find a tick on your child and it's been on for more than 36 hours. The other thing you'll notice about it at that time, the tick is going to start to be engorged. It's going to be kind of puffy, and that will be another sign that it's been on for longer than it should be, and that there's a risk of the transmission of the Lyme disease. So then what do we do if we accidentally miss a deer tick on your child and the child starts to develop the symptoms of Lyme disease? This can happen more easily with a deer tick nymph. They might be on for 2 or 3 days. They're so small it might just fall off and we never notice it. What happens if we start to see symptoms of Lyme disease? What are those symptoms? Well, the best known symptom is the bullseye rash, and that is a pretty large reddened area. A lot of times you might just see a reddened area. You don't necessarily see the full bullseye. Often you'll see a reddened circular area, maybe 2 or 3 inches across. And if you see this, along with your child may have a fever or have swollen lymph nodes, feel achy, have an achy neck, have headache, any symptoms like that, call us right away, and we would want to see your child, and then we would go from there. They would be treated with an antibiotic, usually for 14 to 21 days is typically what we do for the antibiotic to have the Lyme disease taken care of. The old adage of an ounce of prevention is worth a pound of cure is really true with Lyme disease.